based on 4 underlying indicators: the agricultural value added per worker, share of dietary energy from cereals, roots, and tubers, number of supermarkets, and urban population. And last year, FAO used this typology in their SOFA report and added a 6th category of countries in protracted crisis. So on the dashboard, you can see the food system type for each country for the most recent year, as well as past years. And you can view more information on the methods in the publication shown here that's also available in the dashboard resources. Next slide. As mentioned, the food systems diagnostics available on the dashboard show whether these 39 indicators are in the green, yellow, or red, with red indicating a likely challenge area. The thresholds for all of these indicators were set in a few different ways. If there were globally agreed upon thresholds or recommendations, those were used. But for most indicators, those were not available. And so the team looked at the distribution of data across countries to set appropriate thresholds for each indicator. And you can see more information on these methods in the publication listed here that's also available in the dashboard resources. Next slide. The Food Systems Countdown Initiative is a separate but related initiative that brings together 50 food systems experts from across different disciplines and world regions. The Countdown developed a monitoring framework and identified 50 indicators in this framework, and publishes monitoring updates and additional analysis every year in Nature Food and a complementary policy report. All of the Countdown's data and analysis is available on the dashboard. You can view the 50 Countdown indicators in the global dashboard view. You can also view country profiles that show these 50 indicators for each country compared to regional and income group means. And there's an area where you can view the interactions to look more closely at the synergies and trade-offs between these 50 indicators. So this was just a quick introduction. We hope if you haven't been to the dashboard already, you'll take some time to explore, and please feel free to reach out with any questions or feedback. We'd love to hear from you. Thank you very much.
Wonderful. Thank you, Rebecca. Great overview of the dashboard. I'm sure we'll get some questions on that. So please feel free again to put any questions or comments in the Q&A box, and we'll do our best to get to them. Next, I'd like to introduce Sabiha Sultana. Sabiha is a medical doctor with a master's in epidemiology and biostatistics, and she's currently working as an advisor for the Food Systems Countdown Initiative and the Food Systems Dashboard on the Knowledge Leadership Team at GAIN. And I believe, Sabiha, you are based in the Bangladesh office at GAIN. Yes. So any questions about Bangladesh specifically? And she can talk about that. Sabiha is passionate about working with diverse country food systems, understanding their unique contexts, and using those insights to align with country food systems dashboards and the Countdown to support informed policy decisions. Over to you, Sabiha.
Thank you very much, Jess. You have already heard from Rebecca's presentation that Esther, slide. Next slide. You have already heard from Rebecca's presentation that Global Food System Dashboard provides comprehensive national level data. You may be thinking, what is the added benefit of having separate country food system dashboard? When it comes to country-specific food system, it needs to match with country context, address their priorities based on their existing policies, country's vision, and how the transport food system should look like, etc. in future. All those things may vary from country to country. It also needs to ensure the data that is incorporated in the country dashboard used by country government and food system stakeholder. That is exactly what the country food system dashboard wanted to achieve. The country dashboard has been co-created in close partnership with government, civil society, academia, and some country with private sector, and of course with the technical support from the Global FSD core partners to ensure alignment with local priorities and decision-making needs. And data collected and are made available by individual countries at subnational level, like state, province, county division, district, town, that is essential for decision-making and resource allocation. Considering the long-term sustainability, it is aimed for full governmental ownership at the country level. which has already been realized in Indonesia and in the final stages in Kenya. As you can see in the right side, we are currently working in 11 countries, and we have launched 6 countries, the FSD in 6 countries, Bangladesh, Indonesia, Kenya, Mozambique, Nigeria, and Pakistan, covering almost 1 billion people. The other 5 countries that you see is under development: Brazil, Ethiopia, India, Mexico, and Rwanda, increasing the coverage to almost 3 billion. Next slide. So now I'll be sharing how the disaggregated data and the easy understandable visuals are helping policy decision making and resource allocation. Next slide, please. So you can see this is the Bangladesh Food System Dashboard, and here you can see the fish production in national, divisional, and district level data for same indicator. The deeper the color, the higher the value is. The more you want to narrow down your target area and allocate resources, the disaggregated data will help you make that decision precisely. For example, using this district level data will be advantageous for precisely selecting the target area for maybe fish storage or distribution planning, etc. Using these maps, graphs, and we also have tables in the food system dashboard, Bangladesh government is already developing a plan of action for food system pathway with support from FAO, WFP, IFAD, GAIN, and other stakeholders. It is being used to inform both the documents drafting and its monitoring framework. Next slide, please. Next slide. So now you know how the country dashboards are already supporting. I would like to share some of the additional success stories. In Indonesia, they're already being using the development of 5-year regional food and nutrition plans, as well as for reporting the progress made. In Pakistan, government has already owned the food system dashboard. Now they're aiming to publish the first Pakistan Food and Nutrition Outlook, a report generated using the Pakistan Food System Dashboard. In Nigeria, which is the first country that launched the food system dashboard, their civil society organization used the data to advocate for increased wages, achieving 134% increase in the minimum wage. We hope that country dashboard will continue supporting this type of decision making in future as well. That is all from my end. Thank you very much.
Great. Thank you so much, Sabiha. So that gave you a good oversight of some of the work that we're doing at the subnational level. So now I'm going to turn over my MC duties to my dear friend and colleague, Dr. Lawrence Haddad. Lawrence has been GAIN's executive director since 2016 and has steered that organization into a leading one working on food systems. He also serves as a co-founder of the Food Systems Dashboard and one of the co-chairs for the Food Systems Countdown initiative that was mentioned earlier. Lawrence has made significant contributions over the last 30 plus years, Lawrence, working at various institutions, including the International Food Policy Research Institute, also known as IFPRI, and the Institute for Development Studies, among others. Due to his outstanding impact in food systems and nutrition, he deservedly received the World Food Prize in 2018. Lawrence, I'll turn it over to you.
Thank you, Jess. I'm blushing. Thank you for that nice intro, and right back at you. Really couldn't have done any of this without your spectacular partnership. So thank you. Colleagues, it's so exciting to be here because it's so exciting to, be involved with the dashboard and the countdown. But the real excitement is to see how people are using it. People that we've never met and don't know about. So it's so fantastic to hear about what's happening and how the dashboards are being used. But first, let me introduce to you one of my colleagues at GAIN, Katia Pedro. And Katia is a research advisor at GAIN, and she specializes in food systems and nutrition-related challenges. She leads the development of the country food system dashboard. So Rebecca leads on the global side from GAIN, but Katia leads on the country side. And she has significant experience in designing, monitoring, and evaluating programs across Southeast Asia and Africa. Over to you, Katja.
Thank you, Lawrence, and welcome everyone. It's really nice to see so many people attending this webinar. Thanks, Esther, for the slides. I'm going to give you a quick overview of the Food Systems Dashboard competitions that we had. So the first one was in 2020. And as you can see here in the timeline, this happened right after we launched the Global Food Systems Dashboard in 2020. At the time, we had 16 submissions really focused on the global dashboard. And I'm going to tell you more about these submissions in a few minutes. And in late 2023 and early 2024, we launched the 6 first country food systems dashboards. And so at the end of the year in 2024, we launched the competition, really focusing this time on the global and country dashboards. And we had 52 submissions in 2024. And as you can see, half of them were really focused on the global food systems dashboards. We had 3 submissions from Indonesia, 8 from Pakistan, 11 from Bangladesh, and then 2 from Mozambique, 2 from Kenya, and 2 from Nigeria. And so what are the objectives of these competitions? So first of all, this is a way for us to engage with the broader user community. As you may expect, we are closely in close relationships and engagements with our networks, but this is a way for us to go beyond our networks and see what are the users of the dashboard, the broader community. It's also a way for us to gather feedback and insights from users about how they're engaging with the FSD and to allow us to inform future development of the dashboard, both at the global and country level. And it's also a way for us to showcase real-world applications of the dashboard across policy, research, programming, and education, as you'll see with the examples that we'll be showcasing today with our winners. And it's also a way for us to highlight innovative and impactful examples of how users are leveraging the dashboard to drive meaningful impact. Next slide, please. So in this slide, you can see the winners of the 2020 Global Food Systems Dashboard Competition. So the first prize was won by Ramya Ambikapati from Purdue University. And she looked at the impacts of shifts in climate and weather. So looking really at El Nino Southern Oscillation on food security and stability. We had 3 winners for the second prize. So Harvest Plus submitted had a submission to inform the design of their biofortification program strategy for the Sahel, so how the dashboards really inform programming. Riley Wilgenbush from Iowa State University, who's with us today and will be speaking about his submission in more detail, created an educational program for children that promotes global food security awareness. And then we had Jane Arinze Egemoni from Civil Society Scaling Up Nutrition Nigeria, who created a book for children on food systems. And then for the third prize, we had 6 winners. So the Ministry of Agriculture from Ethiopia had a submission. We had university students from New York University and University of Missouri in the United States who also submitted some applications. And then someone from Kato Foods and AgriAllied Global Concepts, which is a food company in Nigeria focusing on healthy foods, who also submitted a submission. And finally, we had a very young participant who won the honorable mention for the youngest participant. And so now I'd like to give the opportunity to Riley to present on his work with children. And so Riley Wilgenbush is a program evaluation specialist for the Colorado Coalition for the Homeless in Denver, Colorado, in the United States. He holds degrees in agronomy and global resource systems from Iowa State University and a master's degree in public health from Johns Hopkins University. And he has previously worked in FAO, USDA, academic research bodies, and nonprofits on projects ranging from dietary sustainability to conservation agriculture, but also maternal and child nutrition. And so, as I mentioned before, his project using the Food Systems Dashboard to engage youth in food security conversations earned him second place in the 2020 competition. So over to you, Riley.
Wonderful. Thank you, Katya, and hello, everybody. Good morning from Denver, Colorado. It's wonderful to start my day with you all talking about this project to engage youth in food security conversations using the Food Systems Dashboard. So we can go to the next slide here, and I will talk a little bit about the project overview quickly. This was done in my hometown, which is a small rural community in Iowa in the United States that's really deeply embedded in agriculture, but somewhat isolated from the broader context of global food systems. There's a lot of talk about, production of row crops and the bottom line, but not a lot of discussion around where that food goes after it's harvested from the field. And we're fortunate in Iowa to be so close to the headquarters of the World Food Prize there in Des Moines. And so at the time of this project, I was studying at Iowa State University, and my advisor from my high school had asked me to come back and talk a little bit about the work I had done in Uganda while I was an undergrad. And so I started to discuss with him what that presentation could look like, and it turned into this project to speak with second graders who in the United States are 7 to 8 years old about food security and about what the work I was doing in Uganda meant for food security. And then we partnered with a local nonprofit to package meals to send to areas experiencing conflict-induced famine. And so we can move to the next slide here. And what I did was I took the anecdotal experience that I had from working in Uganda, and I used the Food Systems Dashboard to help me kind of visualize and summarize data about the state of global food security and draw comparisons between the United States and not just Uganda, but other countries around the world. You can see listed on the screen here some of the metrics I used. I chose metrics that specifically felt like they would be digestible for children who are 7 to 8 years old, because we all know this can be a pretty complicated and nuanced topic. And I was surprised at how well they engaged with that. I'll talk about that in just a second here. But we can move on to the next slide. I did do a little bit of a country level dive in Uganda. At the time, I didn't have access to any of these exceptional country level dashboards, so I'm really excited to see those introduced. But this really allowed me to complement my anecdotal experience with data and paint a really meaningful picture of Uganda for a direct comparison so that kids at this age could understand how different life looks for people outside of their small community in rural Iowa. And so the next slide is the last slide I have and the one that I want to get to the most. And these are some of the takeaways from that presentation. The first is that we underestimate youth at our own peril. I think it's easy to look at a topic as complicated and wide-reaching as food security and think that kids of 7 to 8 years old will struggle to engage with it. But even with this large amount of data and things that we talked about, they still asked insightful questions that started to enter into gender equity, into food distribution equity, into food access. And we were able to have age-appropriate discussions about that seemed really meaningful and showed an understanding of the topic among these young children. And it also fostered a thoughtful discussion about the role of groups like the nonprofit we partnered with and how they contribute to our global food systems and global food security efforts, which spurned a little bit of a larger conversation about what these kids could do at their age and as they got a little bit older. And then the final takeaway I want to mention is just the power of the Food Systems Dashboard. And we've heard about that a little bit already, that there are some very clear applications for this in research and academics and among experts in the field, but it's been so thoughtfully designed and it's such an intuitive and useful dashboard that its application extends far beyond those research and academic and professional settings. To me, if these 7 and 8-year-olds can engage so meaningfully with it, I don't think we should underestimate anyone's ability to engage with it and really understand what that means for food security. So with that, I'm really looking forward to hearing how our winners for this year have used it, and I will pass this off so that we can get to hearing from them. Thank you all so much.
Thank you, Riley, and thank you, Katya. We wanted to. It may sound a bit odd that we asked Riley to come back and present from 2020, given that we're honoring the 2024 winners. But I think Riley's experience is so unique. It's 7 to 8 year olds. You can never be too young to become budding food policy analysts. And I thought some of the questions they asked Riley were really quite remarkable. And I'm always quite nervous about presenting to school children because they often ask the most fundamental and the hardest questions that we have kind of internalized the answers to and we don't think about much. So thank you for willing to come back at fairly short notice and share that experience with us. Colleagues, let's turn to the winners of this year's competition. The dashboard has had over, I'm told, 175,000 users across the world since its launch in 2020. That's 175,000 users. And of those, 50 of these submitted their impactful and inspiring stories to our 2024 competition. And I just want to thank everyone, take this opportunity to thank everyone who uses the dashboard and to all those who entered the competition. It was really difficult to select just a small number of winners, but we're honored to have them with us today. And we're very happy that they're willing to share their stories on how they've used both the global and the country dashboards. So it gives me great pleasure to introduce our first winner. And our first winner is for the Global Food System Dashboard winner presentation for the first prize. And this is Dr. Amina Al-Nishan. Amina is a study physician turned public health researcher with a strong focus on public health nutrition. Her research interest spans maternal, adolescent, and child nutrition and health, child growth and development, gut health, and nutrition-related diseases. She currently works as a study physician at the International Center for Diarrheal Disease Research in Bangladesh, ICDDRB, a world-famous, world-renowned organization, and she is committed to advancing maternal well-being to improve overall child health outcomes. Amina, congratulations, and over to you.
Thank you, Dr. Lawrence, for this nice introduction. So, hi everyone, welcome to the talk on our success story using GAIN's Food System Dashboard. As Lawrence said, I'm Amina, working as a study physician in the Nutrition Research Division of ICDDRB. Next slide, please. So, ours is a team of 3. Along with me, 2 of my teammates, Dr. S.M. Tafsir Hassan, who is working as an associate scientist in Nutrition Research Division of ICDDRB, and Dr. Tahmid Ahmed, the Executive Director of ICDDRB. Today, I am presenting on behalf of our team. Next slide, please. So, our story began as part of our research work at ICDDRB on micronutrient deficiency. In a recent study, we investigated folate intake among pregnant women living in rural Bangladesh, rural Matlab Bangladesh. Folate or vitamin B9 is a very important nutrition for growth and development, and during pregnancy, the requirement of folate increases. However, we found that nearly 98% of pregnant women at Matlab were not consuming an adequate amount of folate through their diet. Deficiency of folate during pregnancy results in congenital anomalies or birth defect. There is strong evidence of the association of antenatal folate deficiency with congenital anomalies such as neural tube defects, congenital heart defects, etc. So, we explored the prevalence of congenital anomalies in Matlab and examined their attribution. To our surprise, we discovered that 65% of the congenital anomalies found in Matlab could be attributed to inadequate folate intake during pregnancy. So we became very alarmed about that and felt that we should do something about it. And we organized a community awareness seminar in Matlab, inviting representatives from across the community, including health officials, local leaders, and other key stakeholders. The visualization and insight from GAIN's Food System Dashboard guided us to adapt and tailor our recommendation for the seminar. Next slide, please. So out of the 300 food system related indicators in the dashboard, we explored several indicators. But for the time constraint, we have highlighted some of them here. Here in this slide, we can see that the minimum dietary diversity for women of reproductive age is very low in Bangladesh compared to other countries globally. On the right side of picture, we can see that the percentage of the population who cannot afford a healthy diet in Bangladesh is lower than the neighboring countries in the dashboard. Next slide, please. So from the dashboard, we can clearly visualize that the Shannon Diversity Index of food availability in Bangladesh is one of the lowest in the world. And on the right side of the screenshot shows that mandatory flour legislation is more common across global countries. However, Bangladesh does not have any staple food fortification legislation. Next slide, please. So this is how the food system dashboard guided us to tailor our recommendation. As the food system dashboard shows poor dietary diversity, we emphasized providing nutritional counseling during antenatal visits to improve maternal dietary diversity and ensure that not only folate but also other micronutrient-rich foods are consumed. As the dashboard demonstrated poor food availability and affordability in our country, we advocated on intake of locally available, culturally acceptable, and inexpensive nutritious food with high macronutrient content. We also postulate that staple food fortification, especially flour and rice, could be an excellent mitigation policy to reduce micronutrient deficiencies at the community level. Next slide, please. So what motivated us to use the food system dashboard? Firstly, the food system dashboard is a very easy to use tool that provides a comprehensive view of the food systems, including food availability, food affordability, and dietary adequacy. It provides not only national level data, but also data across countries, which is super useful for preparing global overviews and designing research. So our learning throughout the experience using the dashboard was excellent. We realized that success in reducing macronutrient deficiencies depends on the combined efforts of several indicators of the food system, such as legislation, awareness, food availability, and etc. Additionally, the food system dashboard offers limitless potential for insights and future collaborative food and nutrition-based research opportunities. Next slide, please. That's all for today. Thank you everyone for listening to me.
Thank you, Amina. That's great. I mean, it's really quite shocking, that statistic of 65% of congenital anomalies related to periconceptual folate deficiency. That's really high. I was really surprised to hear that. And I'm really pleased that the dashboard helped you get people's attention to it and find some ideas for initial solutions. We find that the food affordability index, the food affordability indicator, is really a very powerful one when it comes to governments. Governments don't like it, obviously, that so many of their populations cannot afford nutrient-rich foods. And I think the dashboard's really good at highlighting legislation, surprisingly enough. You know, which food vehicles are fortified and which are not, and you identified wheat, flour, and rice as candidates for that. It's really sweet of you, Amina, to call it the GAIN dashboard, but it's actually managed and owned and updated and curated by the government of Bangladesh, which is, of course, the ultimate, the thing that we're ultimately really pleased about. So thank you so much, Amina. That was fantastic, and congratulations. The second prize in the global category goes to Dr. Tesfaye Helou. Tesfaye is a researcher at Wageningen University in research. He's a senior independent consultant in food systems and nutrition. He has a focus on dietary assessment. He's been a consultant for FAO, the UN Food and Agriculture Organization, and he's been a food system change facilitator at GLOCO Learning. Currently, Tesfaye is conducting research on the implementation of dietary guidelines. It's one thing to develop guidelines, it's another thing to implement them. So he's conducting research on how they can be implemented in Ethiopia. And he's also an investigator for youth engagement in food systems program evaluation in Tanzania and Bangladesh. Tesfaye, over to you.
Thank you, Lawrence, for the introduction. Greetings to all of you. So I will present on the development of food system-based dietary guideline using a food system dashboard. Next, please. So my presentation is more of the quite recent past experience of developing dietary guideline in Ethiopia. Also the implementation, but I believe it is also important at global level, because we see almost half of the country globally, they do not have a dietary guideline at the moment. Next, please. So when we start the development of dietary guideline in Ethiopia, we begin by setting a methodology. As you see here, this is a framework we design at the beginning. So we try to divide our different tasks into 3 different phases. The first phase was coming up with technical recommendation on dietary patterns and also food in relation to health. And the second phase was more of translating this technical recommendation into a reference diet, which is more, we used diet optimization. And then the third part was more of a consultation with different stakeholders who are working in different food system component, so that we can align actually the dietary guideline into the different food system initiative in the country. So in this process, when we begin at the beginning, we did a situational analysis like on food availability, accessibility, and also seasonality in Ethiopia. So for this work, we able to use the food system dashboard. And also in the phase 3 part, because the dietary guideline actually has 2 main objectives. One is giving recommendation for consumers, but also try to support the different food system activities within the country. So in this sense, the food system dashboard was a very important tool for us in the process. Next slide, please. Just this is to give you some of the examples how this the informations we get from the food system dashboard can be useful for the development of dietary guideline. For example, the proportion of urban population versus rural population. This is very important because lifestyle is key determinant factor to see the dietary patterns. So we try to look into those informations, and also the availability of pulse and different food groups, like the availability of meat is also important. For example, in Ethiopia, you see the availability of pulse is quite high, even compared to the East African countries and also the global average. Whereas if you look at the meat, it's quite way too low compared to the East African average or the global average. So we need to consider those availability informations to come up with dietary recommendations in the guideline. The other is, of course, accessibility is also important. We try to look at the number of supermarkets which is not available at the moment. Even the capital city, mostly consumers are depending on the informal market. The other information, what we see here is also the percentage of population who cannot afford a healthy diet. This is also information is very important in a way. Dietary guidelines needs to be more practical and also applicable for the consumers at the end. So these are some of the example of information we try to look into the food system dashboard. Next, please. Why I am motivated to use this food system dashboard also in future is, for example, if you look at the FAO developed a new manual on how to develop national dietary guidelines. In this manual, you see it has 6 different stages. So from my own experience, I see especially for stage 1, which is on designing and also planning the national process. And stage 2 is analyzing the situation and also reviewing evidence. For this 2-stage food system dashboard will have a great contribution in the overall development process. So it is very motivating and also very useful for future to use. Next slide. So this is my last slide about my key lesson and also future application. The global database, like the food system, will help to assess the availability, accessibility, and also affordability of healthy diet. A food system approach will ensure dietary guidelines address the entire food system. It's not just only about consumer behavior or consumers' food choice, but also look at into the other components of food system. Engaging the food system actors, it will also accelerate at the end to implement dietary guidelines, and also the FAO guideline, the new guideline, it will also be very useful tool to guide countries to develop a national dietary guideline. And also the food system dashboard will be a very useful tool to use in this process. Thank you. Next slide. Yeah, thank you very much.
Thank you, Tesfaye. That was great. I mean, things I took away from that are, by the way, congratulations to government of Ethiopia and all the stakeholders in Ethiopia. I understand that the dietary guidelines, food-based dietary guidelines in Ethiopia are one of the newest set of guidelines and one of the best. Not only do they focus on nutrition, they also focus on sustainability of food choices, which is absolutely fantastic. And as Tesfaye said, these guidelines are not just for consumers, they are to guide policy as well as to guide consumer choices. And I think one of the things I really like about the dashboard that I think came out in your presentation, Tesfaye, is the comparator. Some of those graphs, you had Ethiopia data, but then you also had East African data to compare it to give you a contextual representation of where Ethiopia is within the region. And I bet, Tesfaye, that you wish you had an Ethiopian country dashboard with subnational disaggregated data. It's coming soon, and I really hope that you extend your analysis down to the district Woreda and below level in the future. So congratulations to you, Tesfaye.
Thank you.
Let's move on to the country food system dashboard winners. The first prize goes to Siekto Diko. Siekto is a statistician and the head of integrated data processing and the statistical dissemination team at BPS Statistics Indonesia. And that's in the Lampung Utara Regency. He leads the statistical development team. He's passionate about leveraging data to inform policy, drive positive societal change, with a focus on issues such as poverty, food security, environment, and labor. Over to you, Siekto.
Thank you, Lawrence. Thank you for the opportunity to present my work. So maybe before I begin my presentations, maybe I will introduce myself. Next slide, please. So I'm a senior statistician at BPS Statistics Indonesia in Lampung Utara Regional Office. I lead two teams here. The first one is the integrated data processing and statistical disseminations, and also the leader of sectoral statistics development team, which we try to make the statistical development in our country to follow the generic statistical business process model. And I'm also an active researcher. And now I'm currently active on studying about the food security. Maybe next slide, please. So my story and my work is more about the measurement, how we measure the food security. So the first one that comes to my mind when I would like to measure the food insecurity is how many people are struggling with food insecurity, because I think the current index that is available now, it doesn't show us how many people. It's only an index, and it is not useful when you have only a number without know the number. You only have the number. If you only have an index, you only are able to compare it. But if you know the number, how many people are struggling, then it is then the policy will be feasible, and it will be easier for the governments or for any stakeholders to target the specific people with specific issues. So that's my background. That's my reasons to building this index. And maybe next slide, please. So then, so I was inspired by the Alkir and Foster method to create the multidimensional poverty index. So according to FAO, food insecurity is a conditions when all people at all times have physical and economic access to sufficient, safe, and nutritious food that meets their dietary needs and food preference for active and healthy life. So there's 4 dimensions about the food insecurity, and then I use only three dimensions. The first one is food availability, and I get the data from the FSD. So I use an assumption here. I use the average caloric price for every possible food there. So if the average caloric price in a region is under the per capita food and beverage consumption, so I assume in the region the people in the region has incapability to have a food to have a good food. So this is the first indicator that I use, and then the next one is I use a food access. It's more about an economic access. I use the indicator prevalence of undernourishment, and the third one is it's about the food utilization, how we use the food, how you ensure the food is nutritious and it is safe enough. Then I use a 2 indicator from the FSD. It is the percentage of households that have access to safe and improve drinking water sources, and also stunting in children under 5 years. There's also 1 dimension about food stability, but it is not available in FSD, so I cannot use it. So that by using this dimension and the data, I use the framework of Alkir and Foster to measure the poverty, multidimensional poverty, and the result is, maybe next slide, please. Next, yeah. So now we know that there's around 10.21% people in Indonesia experience food insecurity, and then you can also see the maps. I just make a simple analysis with the first quartile. It's the low one, and then the medium one, and also the hard one. And I also found there's a lot of the most number of people in Indonesia that experience food insecurity is in Tolikara in the eastern Indonesia, and the factor that makes them high is because there is 77% people with lack access to water, and 50% of the baby is stunted, and also there's about 51% people are undernourished. So by constructing this index, by constructing this measurement, we know that there's around 10.21%, and I think if we know this number, it will be easier for the policy, for the government, or for everyone to target the specific people with the specific issues. And next, so that's my work about the food insecurity and how I utilize the dashboard. Maybe next slide, please. Yeah, and I would like to share a little about how I experience using FSD. So the first one, when I make this index, I think I did not use the data from FSD, but when I know about this, there's a lot of comprehensive data, so it's enable me to. I think it makes everyone able to copy my work, and also it's from the FSD presents the data until the district level. So I think it's as someone who works in the statistical office, I think it's very difficult to present the data until the district level. So I think it's very good, and because of this complete data, I think, and also regarding the MyMeasure, I think it is also possible for us to do more research and more study about food security in Indonesia. And that is what I can share. That's my work. So I'm thank you for your attention, and thank you for listening to me.
Thank you so much, Siakio. That's great. I really like the way you combined a lot of indicators that were in the red and some that were in the green. You constructed a new index, which gave you, when you add the granularity that the Indonesia country dashboard provides, gives you some very clear indications of where you have food insecurity and where you don't. And you need that granularity because we know Indonesia is a country of 6,000 islands that are inhabited. So you have an incredible diversity in the country, and you need that granularity of data. Of course, we're really excited that a statistical office official and a senior one such as yourself really is enthusiastic about using the dashboard. And again, Bappenas, the Ministry of Development, the Ministry of Planning and Coordination in Indonesia, is the ministry that curates and keeps this dashboard up to date. So really exciting work and really exciting the way you've used the dashboard. And I really take your point to heart about the fact that not only have you been able to do this piece of work, but others will be able to replicate and build on your work, because the data are there and they're free and they're available and they're easy to use. And that replicability is a fundamental platform, a fundamental plank of any piece of good science. So thank you so much for sharing all of that with us. The next, let's turn to the second prize in the country food system dashboard category. This is Dora Kwamboka Momanyi, Dora Momanyi, and she is currently pursuing a PhD in climate change and adaptation while working as a food systems researcher at C4 ICRAF, which is one of the CGIAR centers. Her passion lies at the convergence of food systems, climate change, innovation, and policy. And this is, I think we're going to see this more and more, people who are using food systems as a way of converging nutrition, environment, jobs, resilience. And she drives, this passion drives her commitment to transformative food systems for better production, better environment, better nutrition, and better life. Dora, over to you.
Thank you, Lawrence. Welcome everybody to my presentation. I did a food system countdown index for Kenya. Next slide. So I'm a food system researcher at C4 ICRAF, and I amplify the role of trees, forests, and agroforestry in transforming food systems, a pathway that has been under-researched. And I'm also a young professional alumni from the Kenya Institute for Public Policy Research, working on the NIFPIN project, where I got this great idea. And I'm an African Food System Fellow, where my journey to understand food in a system began. So the potential of food systems to solve the intertwined challenges of food and nutrition insecurity, malnutrition, climate change, biodiversity loss is immense. And in Kenya and in the region, we find that our food systems are at the center, or they're embedded in a diverse agroecological zone, a rich biodiversity, a rich bioresource, both blue economy, aquatic resources, and forest resources. What also motivates me is that there is the potential of the Kenyan youth bulge population, who have the potential to both innovate but also transform food systems, either as early adopters of food systems innovations, but also as vehicles to move around the food systems innovations. Next slide. Next slide. So food systems in Kenya are the third largest contributor to the gross domestic product, and they employ about half of the Kenyan population, either directly or indirectly. And in Kenya, we have a visionary food system pathway, which includes sustainable agricultural practices, promoting diverse diets, bolstering value chains to ensure equitable access, but also creating employment for both the young people and women. However, we have a big challenge that these frameworks and pathways, they often lack they often have an effective monitoring framework to track the performance of food systems for various domains, for various sectors, and even themes. You also find that efforts to monitor food systems are always fragmented and siloed, and there are limited system-level indicators. And in case they are available, you find that tracking is also not available. And there are many data gaps that are inconsistent. So today, we have about 79.2% of the Kenyan population who are unable to afford a healthy diet. 72.8 who are moderately and severely food insecure, and our food systems emit about 59.8% of the greenhouse gases. So indeed, our food systems in Kenya are broken. But to what extent? But when? Why? How? And what are the questions we keep asking ourselves? Next slide. Next slide. So indeed, we need a harmonized one-stop shop for food systems monitoring and evaluation, both for national level and even at county level. And that is where the food system dashboard comes in, which is disaggregated at country level for Kenya, but also for Kenya, it's disaggregated at county level. So we have a number of indicators, we have a lot of data, but when will my policymaker in Kenya go to the food system dashboard to check what is happening with food systems? Or if my community is able to access the food system dashboard, will they be able to monitor the progress of food systems in my country? That is why I developed a robust index to track the progress of the various indicators. An index basically condensing the multiple indicators of food systems to make it easier to communicate insights both to policymakers as well as to my community. I used the 50 indicators from the Food System Countdown Initiative, and I picked 23 for Kenya. And this index established a baseline for 2020, but also has potential to keep tracking food systems progress until 2030, but also disaggregates this information at county level, at domain level, as well as sector level. Next slide. Yeah, so the indicators were from the 5 domains: resilience, livelihood and poverty and equity, governance, and environment, natural resource and production. Next slide. So I obtained 23 indicators, all from the data running from 2000 to 2021, and 23 variables or indicators because this is where data was available. For missing data for these variables, I computed a mean for different data points. Next. And then I did a log transformation just to normalize the scores and reduce the extreme variations. And then the indicators were scaled depending on if the indicator is negative or positive, and finally computed the index. Next slide. So this is the Food System Countdown Index for Kenya. As we see, between 2000 and 2008, we see a fairly constant index. But in mid-2008 to mid-2010, we see a dip. And if you look at the occurrences or the events in Kenya, we find that between 2007 and 2008, we had a post-election violence, and this disrupted supply chains, it disrupted markets, but also access to food. During the same time, there was also a global economic downturn, resulting to price hikes, and so explaining the dip in the Food System Countdown Index for Kenya. In 2012, we again see another dip. Again, during this period, between 2012 to 2014, where we see a dip, we find that there was also a global price volatility. But Kenya was also recovering from a severe drought, which severely affected the northern parts of Kenya. In 2013, Kenya was only transitioning to the devolved system. For various sectors, agriculture, education, were being developed, and during this time we find a temporary slowdown in the implementation of most food and nutrition programs, hence explaining the dip within those years. But in 2015 to 2017, we see a gradual increase in the food system index, which can be attributed to the National Nutrition Action Plan, which was developed in 2012, but only showing results maybe around 2015 and 2017, but also the recovery phase from the shocks that Kenya was going through. In 2020, the baseline for this index, we see an index of about 0.59. A transition phase. This time, COVID is coming in, but we see food systems in 2020 at 0.59, but we could expect a dip if we did a food index for the subsequent years because of the effects of COVID-19. But we see a food system that is underperforming and facing substantial challenges, but also gradually moving or gradually improving. Next slide. Indeed, the index that I have just shown and the data from the food system dashboard is telling a story. And this time it's telling the food system story. In just a snapshot, we see we can identify barriers across years, enablers, we can identify setbacks, but also opportunities to leverage on even as we try to support efforts at national and county level towards building resilient, sustainable, and equitable food systems in Kenya. We also find that the data and insights are key or necessary to make informed decisions, both at policy level, at research level, even at community level, but also very important to track progress and ensure accountability, even as we keep transforming, putting efforts and programs to transform our food systems. To improve the food system index, we are looking at various sectors, agriculture, education, all those sectors that contribute or talk about food, putting more efforts in improving individual indicators across themes, across domains, but also across the sectors. But also to improve the monitoring efforts, we are looking at getting good data, but also accurate data, which is timely, so that we can measure progress. So that in 2020 or 2026 and 2027, we can confidently say that we have made X progress in improving our food systems. We can say we have X gaps, but we can also say we have learned X lessons. And this can enable us make bolder decisions, come up with innovative and bolder pathways to improve and transform food systems in Kenya, but also in the region and across the globe. Asanteni sana. Thank you.
Thank you, Dora. Thank you. That was great. I mean, I really like the fact that you've drawn on experience from being a food system fellow from KIPRA, from C4, from NIPIN. It's really nice that you're able to converge all of that. You're quite right. Most countries, and I'm talking about all countries, including European and North American countries, have pretty weak monitoring frameworks for monitoring food systems. I love the fact that you did this now at the county level. Any of you know Kenya, the 47 counties are essentially 47 presidents who run Kenya. They're very important. If you can get a governor of a county or a president of county in Kenya interested in food systems, you're doing really well. I think it was really clever to use an index, because the index is like a little trailer to a movie. You know, it gets you interested in the underlying data. It's a headline statistic, and I think it's very clever to do that. This is something Siekto did in Indonesia as well. And then I think what's really reassuring is that the trends in the data in the index marry with events. You know, you look at the data and you say, yeah, that makes sense. And it shows how volatile things have become in Kenya after 2008, but it also shows how resilient the Kenyan food system is, that it keeps bouncing back after these various hits it takes. So thank you very much, Dora. And now on to our third and last winner. This third prize and last winner for the country food system dashboard category. We're really happy to introduce Saleh Akram Akanda from Bangladesh. He's a dedicated research officer at the renowned Food Planning and Monitoring Unit, FPMU, in the Ministry of Food in Bangladesh, and it specializes in food security, policy analysis, and sustainable development. A strong background in research and data analysis, Saleh plays a key role in shaping strategies for effective food planning and resource management. Over to you, Saleh.
Thank you, Lawrence, and special thanks to Savia Appa and Esther Mondial. Welcome to my presentation. Good morning and good afternoon all. I'm Saleh Akram Akanda from FPMU, Ministry of Food, Bangladesh. Today I will demonstrate how the Bangladesh Food System Dashboard provides critical data-driven insight to strengthen food security and sustainability in Bangladesh. Next slide, please. My story. Through my work at FPMU, I have always been committed to improving food systems. The FSD was introduced to me as an efficient tool for analyzing complex data and quickly realized its potential in improving decision making and policy formulation. Next, please. Through the FSD, we try to generate and analyze data. The FSD has significantly enhanced our ability to monitor food system and national and local levels. Next, please. Next slide, please. Next slide. Oh, yes. Why I used the FSD. The FSD provides real-time data up to data, streamlining workflows and reducing manual tasks. It enables quick data-backed decision, and I can tailor its report and visualizations to meet specific needs, making it an invaluable tool in our work. Next slide, please. What I gained using the FSD has greatly enhanced my analytical capabilities and operational efficiency. Real-time insights have led to faster, more informed decision-making, and the dashboard has become a core part of our work. Next slide, please. And future use. Moving forward, the FSD will remain a key tool for data-driven decision-making. It will help streamline operations, improve sustainability practices, and foster greater collaboration with stakeholders to create a more resilient food systems. Next, please. Last but not least, to conclude, the FSD is an invaluable tool in transforming Bangladesh food system. It provides the data and insight we need to ensure that food security in Bangladesh is sustainable, resilient, and inclusive. And thank for your time and patience. Thank you. That's all for the time being.
Thank you, Salah. And it's even though you didn't get into the specifics of how you use it, it's really reassuring to know that an organization like FPMU, which is really like a think tank within the government on food, is embracing this country dashboard and is using it to make resource allocation decisions, policy decisions, and to track progress and identify where things are going really well and where there are challenges. So thank you so much for that. Now, colleagues, I'm passing you back to my GAIN colleague, Katia Pedro, for the Q&A session. Over to you, Katia.
Thank you, Lawrence. And thank you all for your questions also on the chat. We've been answering them. And there was a question about the food guidelines in Ethiopia. I know, Lawrence, you also provided some additional comments, but I don't know if Tesfaye, you'd like to add to that, if you have anything you'd like to elaborate further on. Over to you, Tesfaye.
Yeah, thank you. There was a question about supermarket. I think, yeah, maybe looking at the current status of the supermarket coverage in Ethiopia, it is not that important to say, especially if our target is the rural household. However, if we consider the urban diet and also the urban population, because of this, the urbanization is increasing over time, and also the supermarkets actually are one of the main also food supply in many countries, as we see. So it's always good to track of the coverage and how it is evolving over time while we are looking into the dietary shift in Ethiopia, for example. So no matter how it is at the moment in any low and middle income country, I think it's very important indicator. It's good to keep track of those indicators. Also consider it in the dietary guideline revision or development. This is, I think, what I would say. Maybe, I don't know if there are any specific question that I did not address through the chat box. I'm happy to address it, but This is what I want to say. Thank you.
Thank you, Tasfih, for these additional clarifications. And we also have some additional questions for our winners. So the first one, I'll address it to you, Dr. Amina, or the broader ICDDRB team. Were there any unexpected ways you ended up using the food systems dashboard?
That's a very interesting question. So we first came across the food system dashboard through a actually beautifully written article in Nature Food Journal, and it immediately struck us as a valuable resource for nutrition researchers. Later, when we discovered our alarmingly low folate intake among pregnant women in rural Matlab and were planning a community awareness seminar, that's when we instantly remembered about the potential of the dashboard to support our efforts. So if you can see, that was kind of unexpected, but expected for researchers like us.
Thank you, Dr. Amina. Then we have a question about, and I think Sieko, sorry if I'm mispronouncing your name, I think this question will be good for you. Have you used insights from the food systems dashboard to influence policies, programs, or any advocacy work?
Yeah, so because I think there's a lot of indicators from the FSD. So the one thing that we need to think of is how we can use it to just give a like a Lawrence said, a trailer to the food security. So I think what I did is to make an index to like how we are able to compare all the index into the one. So I think it is a very complete dashboard. So if we and because it has a lot of data here, so I think it will when I, for example, like make an index like what I presented before, I think it will enable another countries to just replicate my work. So I think it is very important to know how many people that are in food insecurity. So so I think that's what the important things to have open data platforms. It's replicability. So everyone who did the research and study about the food security or food insecurity will be able to replicate it. So in my perspective, as because I mostly work on how we measure food security and food insecurity, then I think it is also enable us to cross check, like to make the cross check, to monitor each other. So yeah, so that's it. Okay.
Thank you so much. And I'd like to ask the same question to Saleh, as you work at FPMU. So have you used any insights from the FSD to influence any of the policies or programs or advocacy or any other work you're involved in? Saleh, are you still with us?
I guess not, Katya.
Yeah, okay. So I'll move on to the next question. So Dora, this question is for you. If you were to explain the FSD to a colleague unfamiliar with it, how would you describe its biggest value?
Thank you, Katya. So the FSD, to me, it's a one-stop shop that is categorizing a number of indicators that we often dive into, swim through without so much knowledge. And the FSD is disaggregating these into domains and even food system outcomes. So I could describe it as a one-stop shop that is giving clarity on various food systems indicators.
Thank you, Dora. And then we have a question for Tasfih again. So would it be helpful, according to you, if the dashboard integrated more tools or case studies or other training resources? And if so, what kind of resources would you think would be the more helpful?
Yeah, I think one thing is, I think, to have more flexibility, especially when it comes to a country dashboard level. It is important because certain indicators might be quite relevant for some country, but the others will be also relevant for the other country. So having those flexibilities will benefit more the country to give emphasis whatever indicators they are interested on. That is one way, and the other is also to combine this dashboard with other type of dashboards also exist. For example, looking at these food system indicators with maybe global burden of disease dashboard, it might be quite interesting to see how different patterns, what we see in the global burden of disease dashboard, will be more useful also from the food system perspective. So looking at and aligning those different will be fascinating for future use. Yeah.
Thank you. This is super interesting also for us for future developments.
Yeah, thanks.
And then I'd like to see if Saleh is online or if he dropped. No, okay. So maybe Siekto, another question for you. If you could add one dream feature to the food systems dashboard, what would it be?
Yeah, I think it will be. I think when you look at the food system dashboard, there is a subsections there, like food. I think if I remember it correctly, I think it's about food environment, and then there is also about food ability and food supply. So I think if we can summarize it, like all of the indicator there, so we can just give some spotlight to this indicator, like a combinations of all the indicators, just to give us like a trailer, or maybe something that this is the conditions about the food supply and food environment, and also the food and other subsections. I think that would be great. Yeah.
Yeah, thank you for your feedback. And Dora, we'd also love to hear from you what would be the dream feature that you'd love to add to the dashboard.
Yes, to the dashboard, I could also add an easy visualization, especially for the different domains that maybe an index that you can easily visualize that is disaggregated to county level, either to rural and urban areas, but also in Kenya to county level and even regional level. So I could add an index section.
Thank you. And then we have one last question for Dr. Amina or the broader ICDDRB team. How would you see the role of open data platforms like the dashboards evolving in the future?
That's a very interesting question, another interesting question. So, as the dashboard has integrated data from multiple sources, diverse sources across all components of the food system, we wonder it would be impactful to empower it with more artificial intelligence to predict future impacts. And open data platforms like Dashboard have so much potential to evolve from displaying data to becoming more intelligent, interactive policy tool, probably. Dashboards may evolve to become a data-driven, AI-powered tool offering real-time updates and predictive analytics that supports decision making in rapidly changing context and such like. But I see there are so many potential for such open data platforms, what I believe. Thank you.
Thank you very much. This is definitely something we're considering as well. So I think we've went over all the questions we had in the Q&A. We've also, thank you to all the winners for answering all the questions we had, also for you. So if there's nothing else in the chat, no, I think we can also close the Q&A session. Thank you, everyone.
Thank you, Katya. Actually, I want to just quickly ask whichever one of the winners is brave enough to answer. If there was one indicator that you wished had been in the dashboard that you were using, but wasn't there, which one would that be? Anyone want to pick that up?
May I answer it, Lawrence?
Yeah, sure.
Okay, so as we're nutrition researcher, who works on maternal and child nutrition. So we believe additional indicators to assess the maternal health, such as compliance with iron folic acid supplement intake, ANC checkup, adherence to WHO recommendation, maternal nutrition status, maternal and child macronutrient deficiency status. Such kind of indicators would help us more for researchers and also for the policy making. So that's what I believe.
Thanks, Samina. Do those data exist, but they're just not in the dashboard, or they don't exist at all?
There are some some of these indicators, they are not still available on the dashboard, but if there exists data, we have to look for these data as well to incorporate into the dashboard.
Maybe we can engage the FPMU and ask them if some of those could be included. That'd be good. Anyone else?
Yeah. Can I also answer the questions?
Please do. Yeah.
Yeah, for me, I think as I have highlighted in my presentation, I think it's an indicator about the food stability. I think it could be indicator about shocks or vulnerability, but it needs to show the condition of the food stability. I think that is the data that is not complete, because according to FAO, there's four dimensions of food security, and the food stability indicator is not there. So I think that's it.
Okay. I think in the global dashboard, there are some indicators for volatility and stability, maybe not in the country one. So again, something really interesting to look at, and of course, highly relevant given the world we're living in at the moment. So thank you for that. Anyone else on that?
Yeah, maybe, I want to add also maybe sustainability of diet. This is also a bit tricky in a way. What is sustainability means?
You mean environmental sustainability?
In general, to say diet is sustainable, or yes, environmentally, yes, of course, but mostly it is related to animal source food consumption, being more high in greenhouse gas emission, or all those some of the key indicators. But besides that, when it comes to, especially for low and middle income country, there are other issues like post-harvest loss or alternative source of cooking methods, or reducing deforestation. Those are some of the indicators that might be relevant in terms of sustainability. So in general, what is sustainable diet is a bit tricky. So I would like to.
That's why I would encourage you to ask Katya to connect you with, and whoever is working on the Ethiopia Food System Dashboard. I note that our country director from GAIN, Wubit Germa, is on the line. At least she was earlier. I think she will be involved in that process as well. Try to influence, because the country dashboards don't have to follow the global dashboards. Their country dashboards are whatever the country stakeholders want to see in there. So you have agency. Colleagues, thank you so much. I want to call this to an end. I think we've got 5 minutes left. I've got 6 very quick points. First, it was great to see the diversity of the 5 winners. We had researchers and we had government officials, and that's really exciting. One of the worries when we set up the dashboard that there was only going to be researchers. We had 2 worries. Are the researchers going to use it? Because if they use it, it means it's solid and credible. But if only they use it, then it's not as practical and relevant as we maybe would like it to be for policy making and designing resource allocations. So in this admittedly small sample of 5, we have 2 government officials and 3 researchers. Of course, many of you are both. But anyway, so the second point is I was really pleased to see the winners had both sort of direct and indirect impacts. The ICDDRB case study or winning example was very, very direct, looking at how do we design interventions for this group that's not getting enough folate. Same really with the Indonesia and Kenya ones, because they were both indexes at a subnational level, which really helps resource allocations. And then maybe more indirect was the Ethiopia example, and then the Bangladesh FPMU one. both are really important, indirect and indirect, and they feed off of each other. Third, I thought both the global winners, I could see how their work could be really enhanced by the availability of the country level dashboard. So the ICDDRB global winning entry, I think if you can take it to the subnational level and take it to those districts and see if that helps you further refine the development of an effective, impactful, sustainable intervention. And in Ethiopia, it'd be great if you can, once the Ethiopia dashboard is completed, and maybe even you can influence the Ethiopian dashboard in terms of what the indicators are. Your work, maybe we can figure out how, which subnational units in Ethiopia, where are diets most in line with the dietary guidelines. That would be really, really interesting and really useful. My fourth point is that the dashboards, whether they're global or country, are really good at pulling together existing data, but they're also really good at highlighting data gaps. And I think the question on food safety really highlights that gap. We have some food safety data on the global dashboard, but I don't think any of the country dashboards, I don't think, have food safety data. And that's because food safety data are really difficult to get. You only ever hear about a big food safety issue when there's a big outbreak of illness. And it's very difficult to routinely assess the E. coli or aflatoxin quality of food on a routine basis. So I think that the countdowns are really, the dashboards are really good for identifying gaps. Not all gaps need to be filled, but there are certain gaps that really do need to be filled. And I think the dashboards do that. I like the fact that the dashboards are really about building the fundamentals. It's really about the building blocks of policy making, intervention design, diagnostics. It's the building blocks. Yes, we need to bring in AI. Yes, we need to bring in real time. Yes, we need to bring in forecasting. Those are all really, really vital, but we can't do any of that without these fundamental building blocks that are the dashboards. Remember, the dashboards don't generate new data. They pull in, organize, screen, make interoperable existing data. And then, my final point is really just a big thank you to everyone who uses the dashboard. A big thank you to the team, the enormous team at these 4 organizations that pull, make sure the dashboard happens, is up to date, is working. They are supporting the country dashboards. I want to thank them. I want to thank all the users. I want to thank the winners and all the applicants to the competition. It takes effort to apply for competitions. The effort, the winners probably think the effort was worth it. The ones who don't win may regret the effort that they put in. But I've applied for many jobs, grants, and competitions in my life, and have been unsuccessful in most of them. But every time you apply for something and you don't succeed, you learn. And I think for those who didn't win anything in this round, don't be discouraged, because you've learned a lot and you've been brave enough and bold enough to put your ideas forward. My final reflection is, data are so important. I come from a research background, so you'd expect me to say that. But we're living now in a world where apparently information is not important. Apparently data is not important. Apparently evidence is not important. Well, no, it's never been more important. Without data, you don't have evidence. And without evidence, you only have opinion. And opinion is not enough to make resource allocation decisions that fundamentally affect people's lives. So I salute everyone who produces the dashboard, who uses the dashboard and acts on the dashboard and seeks to improve the dashboard. So thank you all for being here. Thank you to all the participants who dialed in. Sorry we were 1 minute or 2 minutes over time. Thank you so much. Bye-bye.